We all would have seen children throwing tantrums. You would have seen them bang their head, you would have seen them scream, yell, lie on the floor. They would do all sorts of things to get things done in their way. So here we are going to discuss about when temper tantrums are considered normal, when it is abnormal, when we should consult a pediatrician, and how to handle children with tantrums. I am Dr. Anuranjana and I am here to make pediatrics simplified for you. If you want more videos on pediatrics or if you have any doubts from this video, you can mention it in the comment section. Also, please like and subscribe to my channel for more such videos and keep learning. So let's get started. So temper tantrums. So temper tantrums are brief, unpleasant episodes which is undesirable, disruptive behavior or emotional outbursts that are extremely and unusually disproportionate to the situation. So these are going to be a brief episode which is unpleasant and undesirable and it is disproportionate to the situation. So when do these children throw a tantrum? So tantrums in children are usually seen in toddlers and it will usually decrease as the age increases and it is seen between 18 months to 4 years. So why do children throw tantrums? So basically it's an imbalance between autonomy and parental attention seeking. So the child wants things to be done in their way. They want the parents to do it for them. So it's a parental attention seeking along with autonomy. When there is an imbalance in these, children throws tantrum. So why do they do it? So there can be a lot of triggers to throw a tantrum. So it can be a psychological trigger or it can be a physiological trigger. So physiological trigger includes hunger, illness, fatigue, fear, or an overstimulating environment. So you would have seen that when children are hungry, they cry, they scream, they yell. When they are afraid of the strangers or if they're taken to a parties, they start to cry or scream unusually. So these are considered as physiological triggers. Coming to the psychological factors, this include inconsistent parenting, failure of the parent to set limits, use of corporal punishment, maternal depression, and lower socioeconomic status. So, in these psychological conditions, also children are shown to throw tantrums and response to unfulfilled demands, frustration, anger, or attention seeking behavior occurs in children. So, coming to the types of temper tantrum can be classified into typical and atypical. Typical is the usual part of a normal behavior and usually occurs once a day, lasting for approximately 1 to 3 minutes. Atypical temper tantrums they occur more than 5 times in a day, can prolong more than 15 minutes. They can suggest an underlying behavioral disorder. So, it can be a presenting feature of a behavioral and developmental disorder like autism. Children with speech delay, behavior abnormalities, developmental disorders will have more frequent and even aggressive tantrums. Coming to the clinical features, so we see tantrums will usually present as episodes of crying, screaming, blowing limb, flailing, hitting, throwing items, pushing or biting. Sometimes it can even lead to breath holding spells. Normalization of mood and behavior happen in between these episodes. So severity, frequency and the length of the tantrum decreases as the age increases and this happens because as the child becomes older, there will be acquisition of skills to identify their emotion, communicate their feelings, and complement positive behavior to manage the feelings or emotions. So, coming to physical examination and laboratory evaluation. So, as a pediatrician who is sitting in OPD, if the parents are concerned about their children, they say that the child shows a tantrum, you look whether it is typical or atypical. For clinical examination, you always remember that tantrum can be a part of a normal behavior, so the child is likely to have a normal physical examination. But we need to look for neurobehavioral disorders if there is atypical tantrum, look for dysmorphisms, look for neurocutaneous markers, look for hearing and vision assessment. in clinical examination and lab investigation, you rule out iron deficiency, anemia, and lead poisoning in children. So you do a complete blood count to look for microcytic hypochromic anemia. You do a child behavior checklist and preschool age psychiatric assessment in 2 to 5 years to assess any behavioral or psychiatric issues, and you look for neurodevelopmental disorders. So, how to handle a tantrum? Now, you're going to advise the parent on how to handle a tantrum in a child. So, remember the mnemonic RID, RIDD. You remain calm, you stay firm in tone, and you ignore the tantrum, distract the child, and don't give to unreasonable demands and unnecessary physical punishments. So, remember RID. You remain calm and stay firmly in a neutral tone. Don't uh, ignore the tantrum and you distract the child. You take the child and leave into a different place, and you do not give in to unreasonable demands and unnecessarily give a physical punishment which can increase these tantrums further. So here is a quick guide to handling temper tantrums. If a child starts to throw a tantrum, is he hurting himself or others? If it is yes, you remove the child from that particular place. If it is no, is he able to be soothed non-verbally? If yes, you hug, you comfort them, you uh, give them a kiss. If no, then you ignore the demands and acknowledge his frustration. Then the child will eventually calm down, and then you express the empathy and you talk to the child on what the child really wants, but never yield to the tantrum unnecessarily. Coming to medical management, 90% of temper tantrum doesn't need a medical management, but if you find iron deficiency, then you can give iron supplementation, which can reduce the breath holding spells. Antipsychotic agents can be given in a low dose in case of severe tantrums, including risperidone and aripiprazole, helpful to decrease the severity in child associated with developmental psychiatric disorders. So when do you refer? When do you refer this child to a developmental pediatrician? So if the temper tantrums last for more than 15 minutes, it is very severe and aggressive and associated with self or harming the others, then you have to refer. And if it is associated with a neurodevelopmental disorder or a psychiatric condition, then the child has to be immediately referred to a development pediatrician for psychiatric assessment. So hope you find this video useful. This can be useful for both pediatrician as well as parents to have a clear idea about temper tantrums. All the details that have been shared in this video is from the Indian Academy of Pediatrics Standard Treatment Guidelines regarding temper tantrums. If you want more details regarding temper tantrums, or if you want other topics in pediatrics, you can always mention it in the comment section, and I am here to make pediatrics simplified and easier for you. Thank you.